and relax completely.
I moved to London about a year ago, a little over a year ago, and I was in chiropractic care in Houston, outside of Houston. And my chiropractor there found me this clinic when I moved here, and it has literally changed my life. I thought I was getting help in Houston for neck and back problems, but there was no traction in that particular situation. And so when I moved here, not only did I get alignment that helped my neck pain tremendously, which I had gotten from cycling for the most part and very bad posture for my entire life, along with lower back and upper back pain that was really caused from bad posture of exercising and walking and working at the computer all day. And now I get traction and alignment adjustments, and I love it. It impacts my ability to live most of my days pain-free, which is amazing.
This is a good example where when you start not only adjusting the spine, but also start aligning the spine to get a better postural composition of the spine and combine that with exercises, the patient starts seeing some really long-standing solutions. Gets pain-free, of course, which is most patients' first reason why they come to us. But then as the spine align better and the movement pattern gets better, patients also experience a lot of other improvements. So that's what I really love about chiropractic biophysics, that not only do we get people to feel better, get rid of the pain, but we also deal with the spinal alignment.
So one last thing I would like to say is that the posture workshop and how much the clinic cares about people's ability to live everyday life and change their habits is really important part of what I love about this clinic that you don't see anywhere else. Because they teach you habits for your day-to-day living so you can get better and be healed versus having to come and have care for the rest of your life because you don't change your habits on a day-to-day basis. So that's really changed my life as well.
The habitual changes that are needed in order to get a long-term solution has often got to do with our lifestyle. So we use computers, we use mobiles, we use tablets, we use varifocals, and all those things put us into a frame of behavior, postural behavior, that has to be broken up and learn how to deal with these modern facilities without compromising the health of the nerve system and the spine. And that's what we teach in the posture workshop. And the posture workshop is a very, very important part of how we get patients to get better, but also stay better. Let's get you on the tape.
Okay.
Big breath in there and out. On your back. Come down this way, please. There we go. Hand there. Relax completely. Just go floppy for me. Good. And the same here. Good. Take a big breath in and out. Eggs. And relax completely. Well done, you. Go up and enjoy the traction.
I will. Thank you.
Here we've got the prolordotic trainer that we use to stimulate that neck curve. In this particular case, we also know that we have a C5-6, where C5 has actually slid a little bit forward on C6. When we have a misalignment like that, the risk is that it causes damage, tissue damage to ligament and disc that can cause a calcification. So we want to get those vertebrae as much aligned as possible. And we do that with the traction, but we also do it specifically with this prolordotic trainer. So let's have a look here. Get your head into position and then push your arms forward. There we go. And we repeat this exercise over and over again with a correct angulation of the strap down and the head coming back. So we keep stimulating the musculature and ligaments and tendons to accept this new position. It's simply when we lose the posture, it's because we haven't used a position for a long time. So force over time have changed the way the spine is orientating itself. And this is one of the exercises that we do to get the curvature back. This exercise can be done in clinic, but can also be done at home. So now we're setting the patient up for the cervical traction with exactly the same objective as we saw with the prolordotic trainer. We want to stimulate that neck curve. And in order to do that, the patient first gets stabilized or anchored. We anchor the pelvis. So now the shoulders are stabilized. We have a forward pull on the thoracic spine because we have a little bit of a hyperkyphosis, too much thoracic curve. So we're pulling that forward with this straps. The shoulders are stabilized, the hips are stabilized. And now we're putting on the cervical harness that goes around the jaw and the head. That will be pulling the head backwards. And then we have the strap around the neck that creates a forward pull. So again, there's a lot of forces that needs to be put into the spine in order to undo the damage that has been done. And as we discussed in the introduction, this is the combination of the specific chiropractic adjustment and the traction that gives the long-term result in a combination with the education through the posture workshop and the home exercises. The variables here are the amount of weight that we put on the pool, the angulation of the pool, the stabilization, the backward head pull, and of course, the time. How long does the patient stay in the traction situation? And we build every patient up from a couple of minutes, and then we gradually build up time and weight.